Radio Health Journal. I'm Reed Pence. This week, Donna Fernandez says she's been lucky. But that's not what comes up right away when patients tell friends and loved ones about their diagnosis.
You know that people's first reaction is, she knew what she was doing. Even the patient themselves feels that stigma.
All that and more this week when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy Radio Health Journal, you'll also like our sister show. Here's a preview of what they're covering on Viewpoints this week.
This week on Viewpoints.
Why did I stay as long as I stayed? Mainly because I was embarrassed. Wasn't that I didn't have the income? Who wants to give up on their marriage?
The stigma that follows victims of domestic violence.
Then,
if I tell you my husband died in 2014 and now I'm remarried and we're raising 4 kids together, you would think, oh, what a happy ending.
No happy endings. Moving forward after a monumental loss. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station, iTunes and Stitcher.
"65-year-old Donna Fernandez of Dallas, Texas, was diagnosed with stage 4 lung cancer about 7 years ago in October of 2012.
I had absolutely no symptoms. I went to the doctor because I kept gaining weight, and I thought I had thyroid problems, and a little knot had come up on my collarbone that she felt, and she was astute enough to think that that might be a problem and sent me for a CAT scan, and lo and behold, I had lung cancer. I did not have a cough. I did not have any symptom whatsoever.
That's not unusual, according to Carly Ornstein, National Director of Lung Cancer Education for the American Lung Association.
Lung cancer often is not diagnosed until it's at its later stage, and that's because the symptoms usually don't appear until lung cancer is in its later stages. Also, sometimes when people experience symptoms, they're misdiagnosed for a while. Symptoms can be like a chronic cough, a cough that won't go away, and that can often be misdiagnosed as allergies or asthma or a really bad cold or something like that. Then, when lung cancer is diagnosed, it's diagnosed most often at its later stages. When it has metastasized or spread to other parts of the body, that makes it much more difficult to treat and definitely impacts the 5-year survival rate.
For stage 4 lung cancer, the 5-year survival rate is only 4%, and the median lifespan from the time of diagnosis is only 8 months. But those statistics don't yet reflect the impact of new treatments, such as immunotherapy. It's helped Fernandez to be one of the exceptions to lung cancer's reputation.
Many people still think of lung cancer as a death sentence. We generally don't like to compare cancers, but I do sometimes bring up breast cancer because it has made great strides in the 5-year survival rate, and it's improved. And many people know other people that have survived breast cancer, but not many people know other people that have survived lung cancer. And so that can be, of course, very frightening.
But when someone gets a lung cancer diagnosis, the support they need might not be forthcoming. Unlike with other cancers, studies show that 3/4 of Americans have a negative bias toward people with lung cancer. The low survival rate is one reason. People don't want to talk about something that seems so hopeless. But that's not what comes up right away when patients like Fernandez tell friends and loved ones about their diagnosis.
The very first question is, I didn't know you smoked.
Many people don't want to be hurtful or judgmental when they ask that question. It's natural to want to know. It's part of gauging your own risk for a disease or trying to make sense of something terrible that's happened. And a lot of people ask that question and they just don't even think about the impacts. However, it is a very hurtful question because it can imply blame. It can imply judgment, and it's just not what you want to hear when you tell someone that you're diagnosed with lung cancer. You want to hear, I'm so sorry, what can I do to help? And not be asked a question that might insinuate that you weren't at all responsible for this terrible thing happening.
Donna Fernandez says she's been lucky. If her friends think she's deserved her diagnosis, they've covered their feelings up. But others have not been so polite.
Overall, the general consensus of the public, including doctors, is that there's not a whole lot of sympathy or concern, or it's you deserve it and we're not going to support you. We're not going to give money for research. You're on your own out there. But I know I was embarrassed whenever I told people that I had lung cancer. Now I'm pretty immune to it, but you know that people's first reaction is she knew what she was doing. Even the patient themselves feels that stigma and blame. When I was diagnosed, I have to tell you, I thought, well, I got what I deserved. I knew I was taking that chance.
But lung cancer advocates say it's not that simple. Personal responsibility certainly plays a role. How much is the question?
Most people start smoking before they're 18 years old. So I always remind people that, most people that smoke wish they could quit. It's incredibly addictive. It's very hard to understand if you've never had an addiction and never smoked, and that people were targeted by the tobacco companies as children. So trying to remember that, yes, there is a component of personal responsibility, but it's not the only issue.
Still, over the past 4 decades, our society's public health campaign against smoking has managed to demonize smokers as well.
Our anti-tobacco message really has, I would call it a public health victory in many ways. It's stopped many people from starting to smoke. It's helped many people quit and understand the risks of tobacco. But an unintended consequence is that it really solidified the link between lung cancer and smoking in the public's mind to the point where it resulted in a stigma. And it resulted in smokers being stigmatized. Yes, it's important that smokers, if they are smoking, that they don't do it indoors or in public spaces, but that has resulted in smokers being kind of cast out from public situations and things like that. And then also the way that smokers have been portrayed in the media, too.
But while it's true that about 85% of people getting a lung cancer diagnosis are current or former smokers, that means that 15% are not. And they're subject to the stigma as well, even though some of them take great pains to make sure people know they didn't smoke.
Sometimes people that have lung cancer that are never smokers or non-smokers feel really strongly that they want to share that they were a never smoker. And for those people, I really try and say, listen, we understand that's part of your story and you should feel completely empowered to share that. But maybe share it in the way that you're saying this because you want to raise awareness that lung cancer can affect anyone, and not to say it in a way that makes it seem like you're trying to release yourself from any blame. Whether you're a smoker yourself or a never smoker, the way that you talk about your smoking history really can impact stigma.
But whether someone's a patient or a friend, should it matter if they smoked?
No. Should it matter? Do we ask people with AIDS if their lifestyle brought it on? No, we've been taught not to. I mean, initially maybe we did, but now we sure don't. Nor should we. Other kinds of cancer can be brought on by, overeating or eating the wrong things, cancer happens to people.
No one deserves lung cancer at all, and especially doesn't deserve to die. Additionally, there are other causes of lung cancer. Absolutely, tobacco is the number one risk factor for lung cancer, but radon gas is responsible for the greatest number of lung cancer cases after tobacco, and air pollution also is a risk factor for lung cancer, as well as secondhand smoke.
Ornstein says the only person who really needs to know if a person smoked is their healthcare provider. But Fernandez says even doctors sometimes have a bias. She relays a story she was told by one woman.
She just lost her husband. He was in his early 50s, if that, very athletic. a bike rider. The doctors totally ignored his symptoms because he was very athletic, young, and a non-smoker. When they finally diagnosed that he had lung cancer, it had already gone to his brain, the chart said, patient claims he has never smoked. They don't even believe them when they tell them that, I can tell you example after example after example of people who have not been diagnosed because they were too young and they had no smoking history.
According to the American Lung Association, there's little direct evidence that doctors withhold treatment, but patients perceive a bias against them just the same. And that's just the start. Ornstein says that stigma negatively affects every aspect of the lung cancer experience.
Patients are less likely to disclose to others that they have lung cancer, which can lead to them feeling isolated, which of course has many repercussions like anxiety and depression. They may be less likely to seek medical attention, so it can result in a delayed diagnosis. Knowing that, something might be wrong, it's probably related to my smoking, and, I knew this was coming, that kind of thing can really make people reluctant to go to the doctor. Once they do have lung cancer, they might be experiencing depression or anxiety or even, some physical side effects, and they might be less likely to speak to their doctor about it, which can make their outcomes worse.
Stigma also affects awareness of lung cancer and the amount of research into treatments.
People share publicly that they have a disease, and then generally their friends and family members and extended networks rally around them and create what we kind of refer to as an army of advocates. And all of that helps raise awareness about a disease state. Lung cancer patients are less likely to share their story and speak publicly because of the stigma, and therefore they're not building this army of advocates. They're not meeting other lung cancer patients. They're not engaging their family and friends in fundraising and awareness efforts. And one reason why that is also difficult is because of the low survival rate. It's hard, people with lung cancer are often very ill, and then if they are not surviving, then they never have the chance to tell their story or build that group.
Reversing lung cancer stigma won't come quickly. Ornstein says it's something that has to happen one person at a time.
If, God forbid, someone were to tell you that they have lung cancer, not to ask, did you smoke? It's very hurtful. It's best to offer support and say, how can I help? And what can I do? Or I'm sorry. If you encounter stigma, if you see someone or hear someone making a comment that's stigmatizing or hurtful, just speak up about it and say, listen, I know it can be really frustrating to see people smoking, but, really it's a pretty complicated situation, and no one deserves lung cancer. And let's keep in mind that these are people too, and that it's a really powerful addiction.
The American Lung Association has a variety of resources available at lung.org. You can find information about all of our guests on our website, radiohealthjournal.net. You can also find archives of our programs there, as well as on Apple Podcasts, Google Play, and Spotify. I'm Reed Pence.
Father's Day is a great reminder that Dad can't take his health for granted. For example, prostate cancer is the most common cancer in American men, excluding skin cancer. Though many men are hesitant, a PSA screening test may be a good idea. That's because prostate cancer is very treatable when detected early. Dr. Robert Meyer of the Swedish Cancer Institute in Seattle says there are several treatment options available. Each man's particular cancer, health, age, and lifestyle will aid in determining which is right for him.
One option to consider is stereotactic body radiation therapy, or SBRT, which delivers very high doses of precise externally administered radiation over a small number of treatment sessions. It precisely targets tumors while minimizing the radiation dose to healthy surrounding tissue.
SBRT can be completed in just 4 or 5 sessions. Talk to your doctor to find out which treatment option is right for you. To learn about one approach to providing SBRT, visit www.cyberknife.com.
Family members are typically the first to notice memory issues or cognitive problems in a loved one, but they're often hesitant to say something. A new survey released by the Alzheimer's Association, however, reveals that nearly 9 in 10 Americans would want others to tell them if they themselves were showing signs of memory loss, thinking problems, or other symptoms of cognitive decline. This month, during Alzheimer's and Brain Awareness Month, the Alzheimer's Association and the Ad Council are launching a new campaign urging people to notice the signs and start a conversation. Ruth Drew is Director of Information and Support Services for the Alzheimer's Association.
Alzheimer's disease is challenging, but talking about it doesn't have to be. We say follow the ABCs, assess changes, begin a conversation, and contact the Alzheimer's Association for help.
For information on the campaign and resources to begin this important conversation, visit alz.org/ourstories.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this broadcast, please support our show by subscribing, sharing it with a friend, and leaving a review on Apple Podcasts. You can find more Radio Health Journal stories about health, science, and technology on Apple Podcasts, Google Play, Spotify, and RadioHealthJournal.net. Also, follow us on Instagram and Twitter at Radio Health Journal.